Hi, Blair here with MXM. Yesterday I talked about our visits to virus ratio and how many clubs we had reporting. Here's an update on that. Currently 1,062 clubs reporting, just over 9.5 million member visits, 417 cases of COVID. Again, that does not mean that COVID case actually was contracted in the club. It means that the Department of Health called the club and said we're doing contact tracing. Somebody tested positive. They worked out at your club on Monday. It's an employee saying I just tested positive for COVID. I got it at a family outing. So this is not necessarily, those 417 are not necessarily happening in the clubs. In fact, we haven't heard of that yet. The visits to virus ratio is now 22,783 to 1. So one case call in for every 22,783 visits. The occurrence rate is 0.004%. Again, 1,062 clubs, 9.5 million visits, 417 cases, 22,783 to 1, 0.004%. We need your data. We need data from all states. And we need a lot of data from all states. If you are open or had been open and reclosed, but as long as you've been open, and we just need your aggregate. So, and if you're going to report again, it's okay. Just go back to the time you opened, give us all your visits, all your check-ins, and all the cases of COVID, whether it's an employee or a member. The way to use this data. Get it out in front of your alliances. IHRSA is going to be getting this out, as is club industry. Take it to your policymakers. Go to mxmetrics.com to register your company, to start to input your data. And on our homepage, mxmetrics.com, these numbers will be on there. We're going to update them at least once a day so that you'll be able to see these numbers grow. And you'll see that is going to be stable, that we're not seeing COVID start or spread in clubs. Obviously not a university study. When a policymaker says, did that come from a third party? You tell them the methodology. Clubs are reporting, but it's auditable. You could go back to those clubs and you could say, let's see those reports, and you could go to the CDC. All of this is auditable, and it's very evident that this is not happening in clubs. What we're trying to do is call attention to our industry and to the good actors in our industry. We want to stop the conversation that says bars, restaurants, and gyms. Let's move gyms into the category where they belong, because this is not starting or spreading in clubs. We have more control points. We can control this better than anybody. Please go to mxmetrics.com. Use those numbers as you wish. Great. If you reference MXM in that, we would like that. That's wonderful. But use the numbers as you wish. We'll keep adding to it. Let's get this industry back on its feet.